What I do with the program is work with the various teams we have across the state that focus specifically on children and families. And we look at those children and families who are having particular challenges that could not be met in the traditional crisis counseling program. So we step in with specialized crisis counseling to help those families be able to meet their various needs, but on a more long-term basis. We have what we call teams, and those teams can consist of up to 10 people. And each team will have counselors and resource linkage coordinators. The counselors obviously provide counseling support, and the resource linkage coordinators actually identify various resources in the community to help the individual and families meet their various needs. The resource linkage coordinators do not have to be master's prepared. They can be a paraprofessional, they can have a bachelor's degree in counseling or psychology or some other discipline. The crisis counselor actually provides that more clinical intensive support. So obviously you need a well-prepared person, clinically prepared person to be able to provide that kind of support. We typically have at least one licensed counselor on the teams, and that person kind of oversees the clinical business, if you will, of counseling support that's needed for our children and families. The team meets and they discuss specific cases that are specialized crisis counseling cases, and the licensed clinical social worker or the LPC kind of oversees the meeting, and they help them attend to the various clinical issues that are brought forth during the presentation of the different cases. So if there's some very significant intensive clinical issue that is impacting the well-being of the clients that one of our dyads is serving, that licensed person will help them make the decision as to whether or not this particular client is appropriate for our services, or they require a higher level of care that we cannot meet their clinical needs, and so we start looking for resources to refer them out. So that clinically trained person is there to help us to be able to make those sort of determinations. We don't want to have families in our program who have needs that exceed our capabilities, and our clinically trained person helps us to make that determination when they have their supervision meetings.